Hi, I'm Dr. Dean Sidelinger, the health officer and state epidemiologist here in Oregon. Today, I'm here to share some news that, while not surprising, I know is difficult for many of you to hear. Today, Oregon is announcing our first 3 cases of the Omicron variant COVID-19. These have been confirmed in Washington and Multnomah counties. Oregon Health and Science University Laboratory conducted the sequencing that detected the variant on December 13th. The individuals that the samples were from were as follows: a Multnomah County resident in their 20s who tested positive on December 7th, who was fully vaccinated. The individual traveled internationally to Canada prior to symptom onset. A Washington County resident in their 20s who tested positive on December 9th, who was fully vaccinated. Another Washington County resident in their 30s who tested positive on December 9th, who was fully vaccinated. The individual traveled internationally to Mexico prior to symptom onset. Additional details about these 3 individuals and their conditions are not yet available. On December 1st, when the first cases of Omicron were reported in the United States, we shared that it was a matter of when, not if, the Omicron variant of COVID-19 would be detected in Oregon. We recognize this news is frightening to many people. However, if history is our guide, we do know that even if a vaccine doesn't target a specific variant, the strong immune response you get from being fully vaccinated can still be highly protective against severe disease from all COVID variants. In addition, continuing to wear masks in indoor public places is another layer of protection we can all take to keep ourselves, our family and loved ones, as well as our broader community safe. Also, following CDC and OHA guidance to get tested following international travel on day 3 to 5 is another layer of protection we can do to help prevent reintroduction of additional Omicron into the state. Whenever you have symptoms of COVID-19 or were told you were exposed to someone with COVID-19, you should also be tested and take appropriate steps to keep those around you healthy. OHA and our laboratory partners will continue to monitor the spread of Omicron in Oregon with robust individual level testing, looking for variants of concern, variants of interest in samples from people who test positive for COVID-19, as well as community level surveillance, looking for evidence of variants in the wastewater across the state of Oregon. Oregon currently ranks 11th nationwide in the proportion of all specimens sequenced during the pandemic. These efforts include sequencing of positive COVID specimens at the Oregon State Public Health Laboratory, through academic laboratories, including those at Oregon Health and Science University and the University of Oregon, and as well as several commercial laboratories statewide. Sequencing of wastewater samples in more than 40 communities occurs across the state through a collaboration with Oregon State University's TRACE program. Vaccination remains our best protection against COVID-19 infection and transmission, including most circulating variants, especially the Delta variant, which currently predominates here in Oregon. Other protective measures include wearing masks indoors and in crowded outdoor settings, keeping distance from others when possible, and washing our hands regularly and staying home when we're sick. If that advice sounds like the same advice we've been giving for a while, it's because it is. When we identify a new variant, we worry about 3 things. Is it more transmissible than previous variants? Does it cause more severe disease? And do our vaccines and current treatments remain effective? Let me tell you what we know about Omicron right now. Omicron appears to be much more transmissible than even the Delta variant, which was much more contagious than previous variants. That means that in communities where it's been introduced, it is spreading quickly, and we would expect the same here in Oregon. Does Omicron cause more severe disease than previous variants? That's where we still need additional information. Some of the early data shows that it's not causing more severe disease, but we've only been dealing with Omicron across the world over the last few weeks, and we still need more information to tell you definitively if Omicron causes more severe disease or not. That being said, even if it causes more disease, but it's not more serious, we would expect more Oregonians to wind up in the hospital. And do our current vaccinations and treatments work against Omicron the way they have against other variants? Here we have some encouraging news. Data from laboratories and other communities who were hit by Omicron before Oregon show that if you're fully vaccinated, and particularly if you're boosted, you are very well protected from severe disease and needing to be in the hospital. While you still may get COVID, that risk appears to be much lower. So let me emphasize again, the best steps you can take to protect yourself, your family, and your loved ones are to be vaccinated, to get boosted at least 2 months after your Johnson & Johnson vaccine or 6 months after your Pfizer or Moderna vaccine, to wear a mask in crowded indoor places, to get tested if you have symptoms of COVID-19 or if you've been exposed to someone with COVID-19, and following CDC and OHA recommendations to be tested 3 to 5 days after return from international travel. That's in addition to your pre-flight test that was done. It's worth noting that the large majority of people who have been hospitalized or sadly have died amid the Delta surge were not vaccinated. Those who are not yet vaccinated really should use that news, as well as the arrival of Omicron here in Oregon, as evidence that they should get their first COVID vaccine as soon as possible. And if you've completed your primary vaccine series and have not yet gotten your booster and you're due, please get your booster. While we may not have been able to prevent the Omicron variant from reaching the state, by taking these steps, we can control how rapidly and widely it spreads in our communities. As we approach the end of 2021, our second year of battling COVID-19, many of us were looking forward to ringing in 2022 with COVID-19 in the rearview mirror. Sadly, that is not the case. We still have Delta spreading widely throughout the state in most counties. Today's announcement with the first detections of Omicron indicate that we still need to battle this virus as we go into the new year. With that being said, we have the tools in front of us to make celebrating New Year's with our family and loved ones much safer. If you're not already vaccinated, please get vaccinated. If you're due for a booster, get your booster shot. In outdoor public places, wear your mask when you're around other people. All of these steps help protect us as individuals, our family and loved ones that we return home to, as well as our broader community. And with that, we can all celebrate a safe and healthy new year as we go into 2022 with the tools we need to help battle COVID-19 and move on to a time when we're not thinking daily about the new announcements about COVID-19 that may impact our daily lives, and move on to catching up with friends, loved ones, and returning to a life that we had before COVID-19. Thank you.